Welcome. Thank you so much, everyone, for joining us. I'm Barbara Beckert with Disability Rights Wisconsin, and very happy to have the opportunity to come together this evening to talk about a very important advocacy topic, the state budget, and how you can have a voice in that process. But before we get started, we're very fortunate to have DRW's board president here with us today. Nancy, can you say a few words to inspire us and kick off the evening?
Good evening, everyone. My name is Nancy Heltemus, and I am the new board president for Disability Rights Wisconsin. I'm really pleased to be here, both as your president of the board and also as an advocate parent myself of a young person with disabilities, and very much a part of all of these advocacy efforts that are going on across our state and across our country and across our world. And I was just at Disability Advocacy Day last week with Barbara and probably so many of you as well. So I'm glad you're all here tonight to continue the conversation. And I'm going to turn it right back to you, Barbara.
Thank you, Nancy. And thanks to those of you who are here with us on Zoom, as well as those of you who are joining us on Facebook Live. So again, I'm Barbara Beckert. I'll just start out with a few logistics. Disability Rights Wisconsin is a protection and advocacy agency for people with disabilities, and we're committed to fighting for the rights of people with disabilities to live as independently as possible, to have choices, and to be contributing members of our community. And the state budget is a very important vehicle for advancing that. So that's going to be our discussion this evening. Before we get started, just a few logistics, and I'm going to be looking at my little list here to remember all of them. We ask that you please mute yourself so that we don't have any noise in the background. That's really helpful. Use the chat box if you have questions or if you are having any trouble that you might need assistance with. We are fortunate that we have some great ASL interpreters available. And if you need assistance accessing the interpreter, let us know. Just put your request in the chat. Speakers, let's all try and remember to say our name before we speak to help with accessibility. We also have auto captioning available, and you can just click on the little caret next to the captioning, and they keep moving that around. But if you go to more and you go to captions, it will allow you to turn captioning off and on depending on your preference. So those are our logistics. So let's go to the next screen. Bob, if you want to bring up the slideshow now, that would be great. We can go to jump right to the second slide. Thank you. So as I said, tonight's an opportunity to talk about how you can make a difference in the state budget. And we'll also provide an overview of disability priorities in the state budget and give you some good resources to help you get involved. And our team tonight, and we'll each introduce ourselves, but includes myself. I'm the Director of External Advocacy at DRW. Bill Crowley, who is our supervising attorney. Phyllis Greenberger, who is our supervising advocacy specialist. And we're really fortunate to have Bob, who is our manager for media and communications and who is helping us with logistics tonight. So thank you so much for that, Bob. Next screen, please. So our message tonight is that your voice matters in the state budget process. The budget's developed over many months, and as we all know, it funds programs and impacts policies that make a difference in all of our lives and are especially important for many people with disabilities. There are a lot of opportunities to influence the budget, and you can make a difference, and that's what we're going to talk about this evening. Next slide. So here's a nice little diagram that gives you a picture of the state budget process. You see the little check mark. That's where we are right now. We've gone through what already feels like a very long process with the governor developing a budget and agencies giving their budget requests. Right now, the budget is with the Joint Finance Committee, and we'll be talking more about their role. Next slide.
Did you want me to jump in, Barbara? Did you want me to do this one?
Sure.
So where are we in the state budget process? The governor has introduced the first draft of the budget that happened in February. The legislature has decided to, instead of just making adjustments to that budget, to write their own version, starting with the budget that was passed 2 years ago. So they're going to what they call the base budget. And then the redo, or this base budget, and writing the continuing on with the budget, is led by this 16-member Joint Finance Committee. So there's 8 senators and 8 representatives, and they take the lead on adding, revising, removing items, and writing the budget for the legislature. Next slide. And so we just wanted to show you who the members of the Joint Finance Committee are. So this first slide shows you the Senate members and the co-chair and vice chair. And then the next slide, if you want to just, shows you the state assembly members with the co-chair and vice chair. And so if you have somebody that is your representative that is on the committee of the Joint Finance Committee, it's great to get in touch with them at this time as they are developing the budget.
Okay. And then, so as part of the state budget process, the Legislative Fiscal Bureau published their analysis of the governor's budget proposal back in March, or earlier this month. And then the next step would be that the Joint Finance Committee is going to hold 4 public hearings in the month of April around the state. The legislators that are not a part of the Joint Finance Committee still have an opportunity to influence the state budget during the JFC process. So, for instance, if your legislator is not on the committee, they can still submit budget amendments to their, it's called a budget buddy, someone that is their designated liaison on the Joint Finance Committee. Then after that, when there's a final version created by the legislature, the entire legislature will have to vote on the final version to pass it. Next slide. Here is the schedule for the public hearings. As you can see, there's one on Wednesday, April 5th in Waukesha at the Waukesha County Expo. Tuesday, April 11th at UW Eau Claire at the Davies Student Center. Wednesday, April 12th, it's going to be at the Glacial Canyon Conference Center in the Wisconsin Dells. Wednesday, April 26th at the Lakeland Union High School Theater up in Minocqua. There's a public website address which is displayed here. The next slide. If you are not able to make it to one of these public hearings and want to watch online, they will all be streamed by Wisconsin Eye, which can be viewed at wisconsineye.org/live. There's also options to submit comments either through email, US mail, or on the Joint Finance Committee website. All of that information is here, and we will be providing these slides afterwards for your reference. If you are able to attend one of the public meetings, you can provide your public comments during the hearing. Additionally, separate legislators might hold their own input sessions to get input from their constituents as well. Next slide, please.
Thanks, Bill. This is Barbara Beckert again. So we wanted to share some tips with you for attending a joint finance committee hearing. And I know that this is a group where some of the people may have had the experience before, and for others, it's a new thing. And if you do have the experience, I recommend it. It is quite an experience for advocates, because there's so many people, usually hundreds of people there who are turning out and who are passionate about some issue in the budget. And we hope that there will be a lot of people who are passionate about issues that are important to people with disabilities. So here's our tips for you so you have a successful experience. First of all, plan ahead. We've mentioned what the different locations are, and we've got a link here for you that goes into a little more detail. Arrange for transportation. A lot of people with disabilities are non-drivers, so planning ahead is important. If you need accommodations, for example, if you need ASL interpreters, make your request as soon as possible. And we had checked with the staff for the Joint Finance Committee, and we have here the contact information for you. Becky Hanna with the Legislative Fiscal Bureau. You can email her or give her a call, but just do it sooner rather than later. And bring a lunch and something to drink, because it is a long day and there may not be any food available there. We're recommending arrive early. The hearing begins at 10 a.m., but there's a long line. As soon as you arrive, you want to fill out a registration slip as soon as they're available and hand it in. The speaker order is determined by the order in which you register. Now, there are some exceptions. I remember getting annoyed because if you're the mayor or the school board president or some other big shot, usually you get to go ahead of the people who've been waiting for hours, but getting there early still does pay off. Each hearing runs from 10 a.m. to 5 p.m. and sometimes they'll go later. Often the hearings in southeastern Wisconsin in the Milwaukee area draw really big crowds, so they might have to go beyond 5 p.m. We're really pleased that because of our colleague Bob, who has graciously agreed to go to each of the 4 hearings, DRW is going to have a table that we staff, and we've done that in the past. And that's a place where people with disabilities can go if they need help with accommodations, if they need help navigating the process, or if they need help crafting their testimony. Bob will be there, and we'll have resources and a computer and a printer, hoping that outlets are available so that he can be a resource for you. So thank you so much for doing that, Bob, and help us spread the word. Next slide, please. So a few more tips for speaking at the hearing. Be prepared. We recommend that you write down what you want to say, bring it with you. That way you've already thought through what you're going to say, because you just get 3 minutes to speak, and believe me, that goes really quickly. So it's a good idea to practice and to time yourself. That's what I always try and do. If you have a message that you can kind of give a catchy slogan or catchphrase for, that can be effective too. So just a couple examples of slogans I've heard over the years, typically about long-term care and getting care in the community. People can't wait. That was a big one, and we don't have waiting lists anymore, but people still are waiting because they can't get caregivers. Keep the community promise was another one. There's no place like home. Those are just a few ideas to get you thinking. I know this is a creative group and you probably have some of your own ideas. And even though you're at the hearing and in person, it's still a good idea to email your comments to the committee and to your state legislators, as well as speaking there. That way it goes on the record. Next slide, please. So this slide kind of gives you tips for what you want to include in your message, your 3 minutes, and we've got 3 steps. So first of all, it's always important to introduce yourself, say where you live, and your job if it's relevant. So for example, if I was speaking, I'd probably mention, that I live in the Milwaukee area, I work for Disability Rights Wisconsin, and I'm also bringing some personal experience as the parent of a young man with a disability. So that personal experience is important. Step 2, talk a little bit about your issue and experience. If you're talking about transportation, for example, you might be able to share how difficult it is for you to get to the hearing that day as a non-driver, or the challenges you're facing getting caregivers, or the difficulties accessing mental health services. Whatever it is, if you can share a personal story or example, that can be something that really resonates with the committee and makes it more likely that they'll remember what you have to say. And then finally, make your ask. So maybe your ask is that you want more money for special education in the budget, or you want to make sure that people who are experiencing mental health issues can get services in the community and don't have to be in a more restrictive setting. Be clear about what you know and share any proposals that are already in the budget that are important to you and your family, and make it clear to legislators what you would like them to support. Next slide. So we've talked a little bit about the process with the hearings, but that's just a part of the process. So let's talk a little bit about the next steps. In March and early April, and that's where we are right now. So the same committee that we keep talking about, the Joint Finance Committee, they are holding briefings with selected state agencies. This week they had briefings with the Department of Corrections and the Department of Transportation. They aren't, for whatever reasons that I'm not really clear on, they aren't inviting all agencies to provide a briefing, but they are hearing from some of them, and then that will inform their budget deliberations. In April, as we've talked about, they're holding hearings on the budget. Then May to June is going to be a really important time. They will take back what they've heard from members of the public, and they will hold what are called executive sessions on the budget bill. That's what we're talking about on the slide, AB 43, or Assembly Bill 43, Senate Bill 70. That's the budget bill. They'll make changes, additions, and deletions. They're already said that they're going to start with the base budget. They're not really going with the governor's budget. So this is a key time for advocacy and to follow up with legislators and share your priorities. Then starting in June, they will vote on the budget bill. They will complete their work as a budget committee and send it to the full Assembly and Senate. Each house will vote on the budget, and they may make additional changes. And then in June, the Assembly and Senate will vote on the budget bill. They have to resolve any differences through a conference committee, and then finally, it will go to the governor. In Wisconsin, our governor has a pretty robust veto pen, so he may partially veto the budget. It's possible he could fully veto the budget. I don't think that's ever happened in state history, but it could. And then he would sign the budget in late June or early July. So that's the big picture of the budget process. Now we're going to turn it over to our crew here to talk a little bit about the budget priorities for people with disabilities that the governor has included, as well as DRW priorities. So I'll turn it over to Phyllis Greenberger to talk about education.
Thank you. Hi, everybody. This is Phyllis. And the first thing we're talking about in the governor's budget is education for students with disabilities. So the first important piece of our budget here tonight is funding special education. The right now it's at about 30% state funded, and the governor has put in the budget to fund it at 60%. So that the state budget would fund 60% of special education costs for districts for both fiscal years. So that's fiscal year 24 and 25. The other piece that's in there is that it is sum sufficient. So there's an amount in the budget, but if it costs a little bit more than that, the state would still pay. So that's what the sum sufficient means. And there's also something in the budget called high cost special education funds for some students that have very high needs. And there's an increase in that as well, from 45% in fiscal year 24 and 60% in fiscal year 25. And that same sum sufficient is in there for this as well. So even if the cost that was put in the budget wasn't enough, they would have to add money, so it was sum sufficient to pay for those percentages. And the high cost special ed at this time is also about 30%. Next slide, please. So there's some school-based mental health services that are in the budget. The first one is funding to reimburse for student services staff. So there was something in the last budget to reimburse schools for social workers, and the budget, it's an increased amount of funding, and it's proposed to include not only school social workers, but also school counselors, school psychologists, and nurses. Additionally, there's some funding to reimburse school mental health services and programs for students. There was an initiative called Get Kids Ahead, which was money used from COVID relief dollars that was sent to each district. It was a smaller amount. And the proposal in the governor's budget is $100,000 per district plus 100 per pupil. So there's enough for each district to have a set amount. Plus, if you have more students, you would get additional 100 per pupil. Next slide. So in the budget, there's also some things about children's long-term support. So the budget directs the Department of Health Services to ensure that any child who's eligible for what's called the Children's Long-Term Support Waiver Program, or you might have heard it as CLTS, receives services. So any eligible child receives services under the program. At this time, it's not written as sum sufficient. So there's an amount. So it's supposed to serve all children that are eligible, but there's a possibility without the sum sufficient that it wouldn't. Then there's also something to expand the birth to 3 program to children with a blood level over the CDC recommended levels. Now I'm going to turn it to Bill.
Okay, then moving on to adults long-term care services. The budget proposal includes rate increases for paid direct service professionals in family care, along with rate increases for personal care workers. Each of those would be 88.8 million in increases over the 2-year biennium period. Also included would be funding to continue implementation of the previous caregiver task force recommendations to address the shortage of healthcare workers and caregivers in the state. There's also the proposal for a 5% rate increase for home community-based services for family care, and also to continue the 5% increase that was provided as part of the American Rescue Plan Act. In addition, there's also a proposal to fund a complex patient pilot aimed at identifying people and approaches that would help people transition from acute care settings back into their community in long-term care settings. Additionally, for family caregiving, there's also a few proposals as well. The first is to provide paid family medical leave for up to 12 weeks for all self-employed workers and part and full-time employees of employers that have more than 50 employees. Payroll contributions would be split between employer and employee. Furthermore, the proposal would expand who can use FMLA leave, so eliminating it for children of the employee, then expanding it to grandparents, grandchildren, and siblings. So you could do it for any age. This budget proposal also includes a family caregiver tax credit, which would allow people that are taking care of a family member to get reimbursed for out-of-pocket costs that are directly related to caring or supporting an adult family member with daily living activities. The maximum amount per year would be $500. The proposal also includes funding for the Alzheimer's Family and Caregiver Support Program, which would just work to strengthen support for people supporting individuals with Alzheimer's, and also increasing the income eligibility limit from $48,000 a year up to $60,000 to allow more people to access the program. There's also an increase for respite funding by $200,000. Next slide, please. As part of the statewide network of aging and disability resource centers, this proposal increases funding for them by providing a half-time position to provide caregiver support in every county across the state. Also to support the costs of the tribal aging and disability resource centers for specialists, I'm sorry. Lastly, there's funding to create a centralized DRC website and database to provide access to information a little more easily about long-term care supports and services. Next slide. So there's also funding in the budget proposal to address abuse and neglect. For instance, there's an increase to funding for adult protective service, to get training, needs assessments for tribal adult protective services, um, along with training grants for guardianship training and elder justice. Additionally, there's the increase in funding for the Department of Health Services Division of Quality Assurance, which has oversight over the long-term care facilities in the state. And this funding would allow for a 25% increase in investigations and responses to the complaints that the division receives. This would include 1 to 2 bed adult family homes, which is currently a gap that is not overseen by DQA. There'd also be 32 additional positions funding at the Bureau of Assisted Living. In addition to that, there's would be funding for 11 full-time positions for the Office of Caregiver Quality to support misconduct and investigations and background checks. Furthermore, the proposal would create a program to promote protection of elders and support the statewide elder abuse hotline. Notable, it does not expand the hotline to people under the age of 60. Finally, there's funds for 3 additional positions to the Board of Aging on long-term care ombudsman program, due to the increasing demand for their services to serve people over 60 in long-term care programs. Next slide. Finally, as part of the budget proposal, there's expanded funding to the intensive treatment program at Northern Wisconsin Center to add up to 92 additional staff positions in order to serve 12 additional residents at that facility. The program serves people ages 14 and older with intellectual disabilities and co-occurring mental health or behavior challenges.
Hi, this is Barbara again. Thank you, Bill, for the summary of long-term care. And I know we had a few people who joined a little late. So just to give people the big picture of where we are right now in this training, Phyllis, Bill, and I are sharing with you the different policy and budget investments that were included by Governor Evers in his budget. However, right now, the budget is with the Joint Finance Committee. That's a committee of legislators. So they're kind of starting all over again with the base budget. So we think it's important to share with you what's in the governor's budget. There are a lot of things that you might think are important for your family or for you or for other people with disabilities. And it's going to take a lot of people sharing their support for these proposals if they're included in the final budget. So that's why we're providing you with an overview of what's in the governor's budget, as well as in some cases what we think might be missing. So here's an example of something that is in the governor's budget: Medicaid expansion that DRW has supported. We think Medicaid expansion is important because it would provide Wisconsin with a good return on our federal tax dollars, more money to provide insurance coverage to quite a few people in Wisconsin, around 90,000. And a lot of those may be people with disabilities who might not otherwise be eligible for Medicaid. It can be difficult to get a disability determination, especially for people who have mental health needs. So this is a way to, cost-effective way to provide health insurance to more people. Currently, Wisconsin is one of only 11 states. So we are a small minority of states that are not accepting the federal Medicaid coverage. And this would bring in a lot of additional federal money, and that would free up state money for other things like special education or transportation or mental health. So we think it could be a win-win. In his budget, the governor has put in a lot of ideas about what the savings, if we expand Medicaid, could be used for. And I'm not going to run through the whole list here, but it is in the PowerPoint, which we have posted on our website. And primarily, it would be used to make healthcare in hospitals more affordable, as well as primary care physicians. And there are a lot of different programs that the governor would propose using those funds for. Medicaid expansion could really be helpful in Wisconsin, DRW believes, but it's going to be hard to get it across the finish line in Wisconsin. It would take a lot of strong advocacy to make that happen. Next slide, please. Dental care. That is something at Disability Rights Wisconsin that we hear about so often. Dental care is really important to keep people healthy. And for many people with disabilities, it's out of reach. They can't get access to a dentist. There's a shortage of providers, especially for people who rely on Medicaid. So there are some proposals in the governor's budget that could help with access to dental care. First of all, there's a grant that would support community dental health coordinators across the state. And the idea of that is that these would be regional programs and that they would help to provide access through dental hygienists, and they would work in patient settings like emergency departments or health clinics or public health departments to ensure that more people who are enrolled in Medicaid get access to dental services. Another way that the governor proposes expanding access is creating a new type of profession called a dental therapist. So a dental therapist is kind of like in between a dental hygienist and a dentist. They have more training and they can do a greater array of services than a dental hygienist can. And they're used successfully in a lot of states, including Minnesota. Unfortunately, the dentists have been opposed to this. They don't seem to want to serve more people on Medicaid, but they also don't want dental therapists. But it's a proposal that DRW has supported. And then finally, there's some money to expand some of the programs currently that serve people with disabilities, both the Marquette University Dental School and Children's Wisconsin Dental Clinic. So if dental access is something that impacts you or the people you care about, I think that this is something that might have a good chance of getting some support in the budget. I've heard from some of the Joint Finance Committee members that they're very interested in this. So that's just a tip. I think this might be a budget issue that has some hope of getting across the finish line. Next slide. Now we're going to spend some time talking about the mental health services proposals in Governor Evers' budget. And we all, I think, have experienced that since the pandemic and during the pandemic, it's really been a tough time. It's really taken a toll on the mental health of many people in our state, adults as well as children. And that's something that I think it's recognized by the governor and the legislature. So we're hoping we'll see some good progress in this budget. And the governor has called 2023 the year of mental health. And he's included a lot of initiatives in the budget. We're not going to cover them all, but we'll give you some of the highlights that are things that at DRW we're excited about. So one is some investments to support peer-delivered services. And folks are probably familiar, but if you're not, a peer specialist is someone who has had lived experience. They've received mental health services, they're in recovery, and they want to use their experience to help other people. And there's a certification process that you go through. So a couple of really positive proposals. One that would support our peer recovery centers. Those are often drop-in centers. They're voluntary. People can go in and they can get support from others who may have had similar life experiences. There currently are 8 of those centers. They haven't had a funding increase for way too long. So this would give them additional funding and also fund 2 new centers. I also wanted to mention, although this isn't in the budget, peer-run respites is something that at Disability Rights Wisconsin, we've been very much supportive of. And Wisconsin currently has 5 peer-run respites, and there have been a couple of new ones added. In addition, there's a peer-run respite center for veterans. So the budget would continue to fund that, but would change the funding source using what's called GPR funding. So that kind of gives it more stability, recognizing that this is a service we want to continue to have. In addition, with the other 5 peer-run respites, there is funding in the ARPA dollars. That's some additional federal funding that was available during the pandemic. And it allowed us to open 2 new peer-run respites, one in La Crosse and one in Milwaukee. And I know I personally was really anxious about this because I wanted to make sure they're able to keep their doors open. And what we've heard is that federal funding will take us through 2025, so through the biennium. So if you're interested in peer-run respite, know that it's funded for this biennium. We might need to do some more advocacy 2 years from now. Finally, there's a proposal to provide Medicaid coverage for certified peer specialists. So right now, if you would like to have support from a certified peer specialist, you need to be enrolled in a program like CCS, Comprehensive Community Services, that includes coverage for peer specialists. You can't just independently get a peer specialist, or hospitals. I mean, they can employ peer specialists, but it's not covered through Medicaid. So this would allow an expansion so that certified peer specialists and also parent peer specialists would be Medicaid eligible service providers, just like a therapist or a psychologist. So that would give a lot more flexibility. Crisis services. This is an area where the governor has proposed that we would fund 2 crisis urgent care and observation centers. And the idea of these centers is that they could actually be a receiving facility if someone has an emergency detention. So right now, if someone is experiencing a mental health crisis and law enforcement makes the decision to detain them, in most of the state, they need to be transported a long way to go to the state psychiatric hospital to Winnebago. And that can be a very traumatizing experience for people. By the time they get there, they're far away from their home and their family, and maybe the crisis is over. So this recognizes that it's better for people in crisis to get support closer to home. Does it solve the problem? No, but it could be a good step by establishing 2 new facilities. They would also have to have statutory authority so that they would be able to receive people who are experiencing a crisis and may need to be detained. Next slide. A lot of things for community services as well. Some of you may be familiar with the Community Support Program. Most counties offer that program, and it's supposed to provide wraparound support for people who have a serious mental illness. And those programs often don't do as much as we might like them to do because counties struggle with funding them. So this proposes that the state would pay the share that the county is currently paying. We think that that could be a good thing, That's what happened with CCS, Comprehensive Community Services, and it's improved access to that program quite a bit. In addition to that, CSP, Community Support Program, it's a psychosocial benefit. So it focuses on things that go beyond medical supports, to helping people with housing and employment and other skills. And there is a proposal to add that psychosocial rehabilitation services benefit for people who aren't already getting it. So one example might be clubhouses that provide employment services. They might be able to get reimbursed. Sorry about that. I seem to be losing my voice when I talk too much. A couple of other community programs in the governor's budget. There's a special kind of CSP for individuals who are involved with the criminal justice system, and it's called a Forensic Assertive Community Treatment Team. Again, the idea is to give people wraparound support that helps not only with their mental health, but with housing, employment, and other kinds of support, and would help them with, any kind of legal needs they have as well. And then in addition to that, the Opening Avenues to Reentry Success, that is a program for individuals who have been in Wisconsin prisons and are re-entering in the community. And there's additional funding for expansion, so that program is statewide. And it's in both the Department of Health Services and the Department of Corrections budget, so you'll hear about it a little later from Phyllis. But this would allow the program to expand from the current 51 counties. Next slide. Suicide prevention. Again, during the pandemic, unfortunately, Wisconsin has really experienced an increase in suicide and suicide attempts. And there are some initiatives in the budget that recognize that. That includes funding for the 988 Suicide and Crisis Lifeline to expand staffing and provide funding for the call centers, and also for establishing a suicide prevention program and have the staff support to coordinate that. Currently, a lot of those efforts are very siloed, so this would try and provide more coordination and better sharing of resources and public awareness efforts. Next slide. This is a proposal that we were very excited at DRW to see in the budget. Individuals who are deaf, hard of hearing, and deaf-blind often face significant barriers to accessing mental health services in their own language and that are culturally and linguistically appropriate. And there is a shortage of providers who can, for example, communicate in ASL. So imagine you need mental health services and you've got that additional barrier. Your provider doesn't communicate in your language, and then you need to get an interpreter, which providers sometimes are not very helpful when it comes to providing interpreter services, even though that's the law. So this proposal recognizes that and provides almost $2 million to develop a new program that would have a charge to develop this workforce, mental health providers who can provide direct service, meaning that they're fluent in American Sign Language or whatever the communication modality is for the client, and that they are able to provide that mental health therapy directly without the need for an interpreter. Of course, we love it. Our interpreters, they provide very important work, but we recognize that getting that direct service is so important to people. Next slide. Substance use disorder services. This is also another area where we're seeing increased need across Wisconsin. And this is in rural areas and urban areas. It's really, truly statewide. There are a lot of proposals here that could really expand access. One is including the room and board costs for residential substance use treatment. Currently, Medicaid does not cover room and board costs, and that can really be a barrier to people getting the treatment they need. And then there are a number of other initiatives as well, some new facilities that would expand, that would be funded by Medicaid, Narcan distribution, and some other additional funding for addiction services. I'm going to turn it over now to Phyllis.
Thanks, Barbara. So there's a few proposals we were going to. There are some other proposals, like Barbara said, we didn't have space and time to get everything in, but a few proposals on children and youth in the mental health area. So one is something called the Psychiatric Residential Treatment Facility. You might have heard PRTF, and that would be a new type of provider for Wisconsin. There are psychiatric residential treatment facilities in other states. It would be a Medicaid reimbursable facility, and they're looking to fund one 25-bed facility. The purpose of this is that there are a number of youth who have been sent out of state in the last several years because they needed a facility like this and weren't accepted into some of the residential treatment centers in Wisconsin. So the idea would be to be able to keep youth here in Wisconsin who need this type of service. There's also money, they've actually broken ground, and there's money to fund 65 new beds at the Mendota Juvenile Treatment Center. So there's an expansion there to include more boys, and also to, for the first time, have space for girls. There's also an additional, the Office for Children's Mental Health, which tries to coordinate children's mental health across all different departments, Department of Corrections, Department of Public Instruction, Department of Health Services, and Department of Children and Families. There is, in the governor's budget, one additional full-time staff, and they're a pretty small office for doing all the things that they do. Sorry. So there's also some increases to Medicaid rates for a few different services. One is for autism services, another is for outpatient mental health and substance use disorder. And then there's also in the governor's budget, a Medicaid rate increase for child and adolescent day treatment. Next slide. So there's some workforce initiatives too, and you've heard us a couple of times during the presentation tonight talk about shortages. I know Bill was talking about some of the proposals to help fund long-term care, and that includes issues with workforce. So just a couple to highlight, there's a qualified treatment trainee grant program. So it's providing GPR funding to sustain current funding levels through the next biennium. And this is to have individuals who are qualified as treatment trainees be able to provide service and be funded in mental health service programs, and supervised for, but to help the agency actually hire these qualified treatment trainees so they can finish up and become fully licensed. There's also some increases in the Wisconsin Caregiver Careers and the Healthcare Provider Initiative grants. And there is a child psychiatry consultation program, which is where child psychiatrists consult with primary care doctors and pediatricians to provide mental health consultation. And there's an increase in annual funding of that from 2 to 4 million. So the next part of our presentation is on the corrections and youth justice area, and the budget areas in Governor Evers' budget related to that. So the provisions for corrections related to treatment and reentry, which is what we're focusing on today, are one is funding that ORS, or the expansion opening avenues to reentry success that Barbara mentioned, is in 2 parts of the budget. So it was on the DHS slide as well. And it's that would expand support for individuals who are who have mental health needs and are at high risk for recidivism. And so an expansion of that program is certainly something Disability Rights Wisconsin has supported. A funding to expand treatment capacity in the earn release program and substance use disorder program is another part of the governor's budget. There's also an expansion to medication assisted treatment, which would fund a pharmacist and physician position at Department of Corrections to serve individuals who are in corrections facilities from the start. So there is some programming currently in the community, but this would be for DOC facilities. And then the last one here is the expansion of alternatives to revocation. So sometimes individuals are on probation and are taken back because of violations of rules of their supervision while they're on probation. So instead of having to go back to prison, there are residential community beds, and this would increase that by 100 beds. Next slide, please. Oh, thank you. Youth justice. So there's some things in the governor's budget around this. The first one is raising the age for adult court to 18. So some people might not know, but in Wisconsin, if you're 17, you're considered an adult for criminal prosecution purposes, and that includes misdemeanors and felonies. So if you're 17, you're an adult when it comes to that. And we are now one of 3 states that are still treating 17-year-olds as adults in this way. So it's Texas, Georgia, and Wisconsin. And this would put 17-year-olds back into the youth system and raise the age of adult court to 18. And again, we talked earlier about some sufficient, which means there's an amount in the budget, but if it's not enough, then they would need to add money. So it is sufficient to reimburse counties for any increased costs they might have with the raising of this age. So counties are not serving 17-year-olds right now, so they would need additional funds to do that. It also provides funding to develop a youth justice data and reporting system and to continue to license what's called the YASI, or the Youth Assessment Screening Instrument. And the Youth Assessment Screening Instrument is a evidence-based tool to look at both, sorry, like Barbara, talking too much and I start coughing, sorry. It's a evidence-based tool that assesses both risk and needs for youth, and is being used across Wisconsin. And lastly, in youth justice, there is funding for bonuses to counties who would operate something called a secure residential care center for children and youth. You may hear the term CRC. I don't know, we like to make everything an acronym here in Wisconsin, but there is a plan to close Lincoln Hills and Copper Lake, which is a facility, a Department of Corrections facility, and have one smaller type 1 facility that would have only individuals who are either in the SJO, which is serious juvenile offender, or have been charged as adults, would go to that, and the counties would serve the rest through these secure residential care centers. And if they're serving multiple counties, in order to make it so one county isn't fitting the bill, in case they don't get enough students, or enough youth, there'd be bonuses to those counties. Next slide, please. So the other thing that the governor's budget does, there's a lot of different reforms that have been talked about for many years in the youth justice area. And one of the things that the governor does is create a juvenile justice reform committee that would have to report back to DCF, Department of Children and Families, who does the oversight of all the community-based youth justice system, and the Department of Corrections, which has the facilities. And they would have to report back on a variety of different reforms, including this issue of raising the age, modifying waivers, changing the serious juvenile offender program. So it's a variety of things. There's a mention of a few on this slide, but there are some other things that they would have to report back to Department of Children, Families, and Department of Corrections on. Next slide. And I'm going to hand it back to Barbara.
Thank you, Phyllis, and thank you for highlighting those really important proposals that impact so many people with disabilities and mental health needs that are involved in the criminal justice system or the youth justice system. And that's why those areas are such a priority for Disability Rights Wisconsin, because unfortunately, so many people with disabilities are impacted by our youth and adult justice systems. We'd like to see that change. So transportation, interesting fact for you, 31% of Wisconsinites are non-drivers. That's a heck of a lot of people, and many of them are people with disabilities. And very often our transportation budget tends to focus on roads and highways, and those are important, but we want to remind the Joint Finance Committee that there are a lot of people who don't have a car and who don't drive. And that's really what informs the transportation recommendations that we're going to be talking to you about. So we're not talking about bridges and roads. We're talking about transportation for people who are non-drivers. So Governor Evers' budget includes some investments in that area. For mass transit aids, and that's for buses for the most part, there's an increase of 4% each year. For paratransit, and that is for larger counties for the most part, there's an increase also of 4%. There also is a program that would provide assistance for transit capital expenses. That's like buying new buses. Those do need to be replaced, and a lot of counties, including the one where I live, Milwaukee County, are really hurting in that regard. They would also allow local government to collaborate to fund what's called a regional transit authority. And what that would mean is, we all know people's lives don't stop at the county line. And if you're a non-driver, your transportation probably does stop at the county line. Buses and paratransit systems do not go across the county line typically. So this would change the law and allow counties who wish to do so and municipalities to take a more regional approach, something that we've thought has been needed for a long time. In addition, there's some funding for the specialized transit assistance program. That's typically for smaller counties that don't qualify for a paratransit program because they don't have what's called a fixed route program, or buses usually. There's also increased funding in each year of the budget to fund coordination of services for non-drivers. So just a tip to share with you, disability advocates, Disability Rights Wisconsin, the Board for People with Developmental Disabilities, and some of our other partners, including aging advocates, have been talking about how we would like to see a bigger investment in transportation for non-drivers. So while it's great that the governor proposes an increase, we don't think that that's enough. And we are talking about working on a proposal to increase funding by 10 to 20% for existing mass transit, paratransit, specialized transit, and mobility management, which helps people with navigating these systems. Another area that is in the budget, and that's a priority for Disability Rights Wisconsin, is voting rights. And the governor has included a number of positive proposals. There's some additional staff for the Election Commission. There is automatic voter registration that would allow people, when they get a driver's license or photo ID at the Department of Motor Vehicles, to have the ability to be registered to vote at that time. We don't think there's support for that with the Joint Finance Committee, so it's probably one of those dead on arrival proposals, but we think it would be helpful and make it easier for people to register to vote. Governor proposes changing the residency requirement for voting back to 10 days. So if you've lived somewhere, you move, once you live there 10 days, you can register to vote at your new address. There's a proposal to allow communities to count absentee ballots sooner so that they don't have that pressure to do it the night of the election. And in big communities, sometimes that takes until early the next morning. Extending in-person absentee voting, requiring polling places to post a voter bill of rights, and reinstating some provisions that used to require high schools to help students with voter registration. There's also a proposal to provide funding for municipalities to purchase Badger books. And if any of you have been voting in person, you may have used a Badger book. Some communities have the money to get these. It's like a electronic poll book, and people love them. They really speed up the process of voting and make it more efficient. Next slide. So while the governor included some positive proposals for voting, he did not include a number of proposals that disability advocates had hoped to see. So I'm just going to mention those quickly. We would like to see funding transportation specifically for voting related activities. At DRW, we have a voter hotline, and that's one of the areas where we get a lot of calls. People who need transportation, especially accessible transportation. Funding to help support the work the Election Commission does and that our agency helps with, to review polling places for accessibility and to help provide accessibility supplies. Expanding service hours at the Department of Motor Vehicle locations. That's where people need to go to get a photo ID for voting if they don't drive. But if you don't drive, you may have difficulty getting in at the DMV because their hours are only in big areas. They're during the workday, not on evenings and weekends typically. And in rural areas, they're often just open a couple days a week and not even for a whole day. And it might take you an hour to get there. And if you're not a driver, that can be very difficult. So we would like to see expanded hours and more mobile sites that can go to where people need help. And finally, and this is especially a priority for people with vision loss, we would like to see a screen reader accessible, ADA compliant absentee ballot. So those are our voting recommendations. We're going to go now to a quick look at employment. There is a proposal in the budget that would get rid of the current prohibition that any unemployment insurance claimant who is on SSDI is not eligible for unemployment insurance. That seems really inequitable, and this proposal recognizes that, and instead it would require that the claimant could get the unemployment insurance, but their benefit would be reduced by the amount of the SSDI payment. So that is our walk through the budget. I know we covered a lot, and we're going to circle back now as we wrap up to give you some options for action, kind of summarize what we talked about at the beginning and also throw in a few new ones. So first of all, we have some homework that you might want to consider. It's an easy thing to do. You could consider calling your legislator's office to share your budget priorities. And one thing that is a tip is that you can call any time of day or night and leave a message. Sometimes people are anxious about calling their legislator, they're nervous about it. So call in the evening, get voicemail, and leave a message. Just be sure to say your name, where you live, and your phone number. Let them know you're a constituent, and then share your budget priorities. Email. Staffers do keep track of emails from constituents, so that's an important way to communicate. You can ask your legislators to meet with you in the district. So that's close to home. That's more convenient for a lot of people. Or if you're going to be at the Capitol, you can schedule an appointment. If you have a community event coming up, or if you work at an agency, you can invite them to visit. And finally, we talked about how to submit written comments to the Joint Finance Committee. You can do that on their website or through email. Another trick that can be helpful in building a relationship is using social media. If you're on Facebook or Twitter, Find out who your legislators are and then follow them on social media. And you can offer them suggestions about what you would like to see in the budget. Another way to get an idea more visible is to write a letter to the editor. Legislators typically do read their local papers, and some papers like the State Journal have circulation around the state. And then finally, attending a hearing. We talked a little bit about that earlier. Not only are there joint finance hearings, but most legislators also have hearings in the district. So that might be more convenient for you if you can't take a whole day to go to a finance committee hearing. So I'm going to turn it back over to Phyllis to give some other tips.
So next slide. There we go. Thanks. So one way to find out if you don't already know who your legislator is and who represents you in Wisconsin is to go to the main page of the Wisconsin State Legislature, which is legis.wisconsin.gov. And there's a big circle there because one of the things on their front page is who are my legislators. So you enter your address and you can find out who your legislator is. Next slide. So like we said, the who are my legislator, how do you contact them? You can go to that page, find out who they are. There's also a legislative hotline, 800-362-9472. There is a website for the Joint Committee on Finance, which we mentioned earlier. There's also a Joint Finance Committee website. So there's the, looks like there's two things here. Are they two different websites? One is for topics and budget comments, and one is their committee, I think. So
Yep, you got it.
Thank you. And then there's also that email we talked about before. If you aren't able to go to one of the hearings and you want to provide input, you can send written comments to their email at budgetcomments@legis.wisconsin.gov. And those, and actually we encourage people to submit their written comments, even if they're going to a budget hearing. So they have them in writing as well. There's also additional resources to learn about the budget. So there's the executive budget we have a link to. There's the budget bill that there's a link to. So when you get a copy of these slides, you'll have all of these links for you. There's a link to the Department of Health Services. So what are the governor's budget proposals for the Department of Health Services? There's the Joint Commission on the Joint Committee on Finance. You can sign up for their notifications at the next link. And there's a link to the Legislative Fiscal Bureau. And lastly, a link to the biennial budget.
Oh, thank you, Phyllis. This is Barbara again. Well, we know we've covered a lot of material with you tonight. We hope that the overview of the budget was helpful, gave you some ideas that spoke to your priorities and what's important to you and your family, and also gave you some ideas for how you can be involved. So one final suggestion is to remember we have a really important election next Tuesday, April 4th. There's someone who will be elected to our state Supreme Court and will serve for 10 years and make decisions that have a big impact on all of our lives and on the rights of people with disabilities. And depending where you live, you might be voting for mayor or school board. In my case, I'm voting for a new state senator in Senate District 8. So just want to remind you how important that is. Next slide. And that people with disabilities do have a lot of rights to accommodations, which people are not always aware of. So next slide. We're here for you at Disability Rights Wisconsin. Our voter hotline's open all year round. So if you do have questions or concerns, give us a call or email us. We would be happy to assist you. So got some other websites as well, and that's all going to be in the handout that's available on the DRW website. And we'll send a link out as a follow-up email to you. So thank you so much for joining us tonight. You can take that down now, Bob. thanks so much for your help with the logistics and sharing your screen, Bob. And thanks to the interpreters as well for their hard work, keeping up with all of this really dense information. We appreciate your joining us. We'll just stick around for a minute or two in case there are any final questions. I know there's some things in the chat that might be a little bit outside of the scope of our budget discussion tonight, but we hope that you got your questions answered during the presentation. So thank you, Bill and Phyllis and Bob, and thank you, Nancy, for kicking us off tonight.
Sure.
And then
Yeah.
Leah, Barbara put a link in the chat to this presentation that's on our website. So she mentioned it was on our website, but if you want to grab that link before we sign off, there's a link in the chat.
Yeah, thanks, Phyllis, for that reminder. And I will send out an email with the link as well. And we will save this recording. And it is also, we hope, on Facebook Live, reaching additional people there. So thank you, Bob, for getting that set up. All right. Well, everyone, good luck
Good night,
with your
everybody.
budget advocacy and have a good evening.
Thanks for joining us, everyone.
Thank you.
Yes, thank you. Good night.